You owe this woman an apology. And I'm going to show you why. This is Dr. Immanuel. This is the day she spoke in support of using hydroxychloroquine in an outpatient clinic to help treat coronavirus.
We have to continue to question why social media is censoring certain things, such as her speech talking about certain medications that can be used in the outpatient setting appropriately. She is in the medical field. She is a licensed provider. But why is it that we can't talk medication treatment? Even when the AMA said that it was appropriate. I have a lot of questions, especially on social media. Certain things are censored, especially life-saving things. There were incidences where people took the wrong type, like fish cleaner, which is chloroquine, fishbowl cleaner or whatever. We're waiting too late to treat these patients. Let me show you a couple things from the American Medical Association that's not being talked about. This chart is included in the report, but first you have to understand the stages. Stage 1 is the early infection, the viral phase. Stage 2 is pulmonary phase. Stage 3 is hyperinflammation phase. Here's a report, as you can see at the top, from the American Medical Association. Early in the pandemic, the president of AMA had contacted LARA, the licensing bureau for prescribers, licensed professional prescribers, and told them not to prescribe hydroxychloroquine until November. As of November, they rescinded that statement, stating that a proposed regimen to treat COVID-19 for stage 1 is appropriate with vitamin D, zinc, hydroxychloroquine, and azithromycin. The inappropriate use was using it in stage 2 of COVID-19. Stage 2, remember, is the pulmonary phase, and usually these patients have been admitted to the hospital. The AMA also supports prescribers' autonomy. All in all, it's been resolved that the American Medical Association rescinds its statement calling for physicians to stop prescribing hydroxychloroquine until sufficient evidence becomes available to prescribe medications that are in the best interest of the patient. I will also add that prescribers have been using medication for off-label use for years, whereas this off-label use has been supported by other policies by the American Medical Association. All in all, the AMA reassures the patients whose physicians or prescribers are prescribing hydroxychloroquine and combination therapies for the early stages of COVID-19 diagnosis by issuing an updated statement clarifying their support for a prescriber's ability to prescribe an FDA-approved medication for off-label use. These are drugs that are approved by the FDA for over 50 years. And we have used many medications for off-label use, such as Viagra. Viagra was not first intended to be used for erectile dysfunction. It was first intended to be used in men, women, and children for pulmonary hypertension. This is no different. Everybody's so distracted with the vaccine, but nobody is talking about treatment. Why aren't we talking about that? Interesting.
A lot of doctors in America are kind of scared, of course, because everywhere here is hyper-specialized. Everybody's hyper-specialized. And then a lot of the doctors that are saying that, oh, this doesn't work, they all have like exotic specialties like, plastic surgery and, dermatology. They don't see patients. They don't see COVID patients. They've never seen any. So of course they are scared. They hear the narrative of, oh, this medication will kill you, and then they're scared. But hydroxychloroquine is like one of the most... I would say it's one of the most safest medications.
Yeah. All in all, there was no reason for her to be dragged across Black Twitter. No reason at all. We can't cry that there's medical mistrust because there's nobody in the healthcare field that looks like you. When we're here and we're trying to help, but you don't want to listen. And you pick and choose who you want to listen to. The negativity goes viral, but the education doesn't. Make it make sense. We will continue to die from the lack of knowledge. Consider the source. All in all, what we can learn from this whole situation is to consider the source. We'll listen to a fashionista like Kevin, Mr. Kevin, degrade black women. But when a black woman, an educated black woman, a physician at that, is trying to do a humanitarian role and teach about a potential treatment that can actually help the general population, then she's dragged across Black Twitter. Let's please consider the source, and let's stop with the negativity and trying to divide and conquer, and let's listen more and consider it. Collaboration over competition all day long. This ain't the battle of the sexes. Thanks for listening to The Real Nurse of Detroit with your favorite nurse practitioner, Nurse Practitioner V. This was my 5-minute consult. Use your melanin to become a melanaire. You're either going to be a billionaire, a millionaire, or you're going to be a witness in this pandemic. Which one you going to be? Use that melanin.
Become night, dark, like sexual chocolate. The children is our future, but they sell them and market them. Peddling melanin across seashores. To the wicked, I'm just considered a human resource. Cause I'm melanin rich, I'm a melanaire. Melanin rich, I'm a melanaire. Melanin rich, I'm a melanaire. Melanin rich, I'm a melanaire.
Welcome to The Real Nurse of Detroit. This podcast is for patient education in a fun, interactive, unfiltered, conversational way. We are here to answer all of your questions and get rid of all of the myths you see floating around social media. I am your host, Nurse Practitioner V, along with my nurse and doctor friends. We also want to apply our medical knowledge to real life. So keep listening to the Real Nurse of Detroit podcast.